Welcome to the All In podcast. Dr. Dave Shirazi, how's it going?
I'm doing great. How are you?
I am doing good, and I'm so thankful that you're here because I'm excited. I mean, we already had some pre-show banter, and I'm already excited about what we're going to dive into.
Yeah, I love how enthusiastic and excited you are to hear about it. I'm excited to tell you about it.
Yeah. So I know we talked, we kind of were starting to talk about mouthpieces and mouthguards and TMJ and jaw alignment, and we'll definitely dive into that. I want everyone to know we're gonna touch on that, but I want to start off with sleep. Could we start with just kind of improving or talking about, what sleep is, kind of just the basics for anyone who doesn't really understand the science of sleep?
Yeah. So to me, the most important aspects of sleep. So we have 4 stages of sleep: stage 1, 2, 3, and REM. Okay. And what we believe is the most important parts of sleep are stage 3 and REM. Now, stage 3 is where we get almost 100% of our growth hormone. Over 90% of our growth hormone comes from that stage of sleep. And then REM is where we do our mental and emotional processing. Right. So memory consolidation, processing of emotions that went on to the day. Our REM is working overtime, in these stressy times.
Oh, yeah.
And we even finding out that our lymphatic system in our brain clears out the beta amyloid plaques during REM. Right. So there's still a lot we don't know. And I know this sounds like a clickbait kind of statement, but it isn't. Sleep is more important than diet and exercise, right? It doesn't mean you don't need diet and exercise. I'm just saying in hierarchy wise, it's the most important thing.
Right. And we know sleep affects stress, but stress also affects sleep. Could you kind of go over some the importance of sleep and how it affects our lives?
Yes. So after we're done growing, we use the growth hormone to repair, right? So whether it's working out at the gym, having an injury, whatever it is, we need growth hormone to repair, okay? Physical repair. When it comes to REM, like I said, that's where we do our mental, emotional stuff. So we have a phenomenon called an arousal. An arousal is when we get kicked out of delta or REM for 10 seconds or greater. Right.
Okay.
And the things that can kick us out of REM are, the general things, the most common things are snoring and sleep apnea. That's the most common things especially that I treat. But anything like a noisy neighbor's dog that barks in the middle of the night, right? A bed partner with snoring and sleep apnea, right? But also little things. So if you have a glass of wine or 2 before bedtime, we know it helps us fall asleep, but we get lighter sleep. We get less delta and REM. Yeah. And so when we're lighter sleep, the way we discuss that in the medical literature is we're more vigilant, right? And the more vigilant we are, the more prone we are to arousals that happen to be, a little bit of extra light coming in through the window, a dog that just barks once versus, incessantly, and things like that, if that makes sense.
Right. That totally makes sense. And so I know you come from the dentistry world. So how does that intertwine with sleep?
Well, excellent question. So with the context of snoring and sleep apnea, right now, the most commonly used treatment is what's called a CPAP machine. You wear this mask and it basically it uses pneumatic air pressure to blow your tongue and throat area open. Okay. Because people think that it's forcing air down your lungs. It's not intended to do that. It's just blowing the air in the throat. And then when you breathe, you fight against the air. Yeah. Okay. And it works. It works it has something like a nearly 100% success rate in terms of resolving the snoring or the sleep apnea, I should say, while you're wearing it. The issue is it has a less than 50% compliance rate. It has a really poor compliance rate. Which is a problem, right? So oral appliance therapy to treat snoring and sleep apnea. Also, they have thousands of articles on the efficacy of oral appliances. We're finding that people tolerate it 75, 80% of the time. So it's tolerated about twice as good as CPAP, but it's only about 75 to 80% as efficacious as the CPAP.
Okay.
Right. So there is that. In my lectures, when I lecture to dentists and doctors, I tell them it's sort of like the difference between ointment and suppository, right? Suppositories work better than ointments, right? But you have to bend over and do it every night.
And nobody wants to do that.
And not very many people do. I mean, if you're, listen, if you care enough about your health, you will, but ointment, hey, it does the job 80% of the time. And it's pretty convenient. Just rub it on, then you go to bed. It's pretty easy. So you just kind of like you pick what works best for you. And in my personal experience, people have sort of already made up their mind, right? So by the time they've come to see me, because some people will say, I'm afraid to even go to my doctor to get a sleep study because I'm afraid he's going to tell me I need a CPAP. And I know I don't want it. Right. And I said, don't worry, you have a choice. The first thing to do is get tested. But I also have patients that, like, for example, I had a patient that worked in a fire. He was a fireman. He worked on a fire precinct. And he said, everybody in the precinct wears a CPAP. If they can do it, I can do it. And we didn't even have to try a whole bunch of masks. He knew he was going to do it. Wow. And he was able to tolerate it. The psychology of this, in my opinion, supersedes everything. But yeah, it's kind of, people have already have it made up in their mind. And people, with the divorce rates being so high, there are people that say, I'm single, and it could be men or women. They go, I'm single. Now that I'm dating, I'm in my 40s. I don't want to go on a date and then wear a CPAP and sound like Darth Vader. It's like, okay, I understand.
That's very similar to, what I hear from nutritionists or coaches, in a sport or a certain goal. There could be, diets that work best or workout programs that work best. But realistically, it's the program that you can stick to that's going to be the best one for you. And everyone's body is different. So they got to do the testing, but also it is the psychological piece. That's huge, because it's what can you buy into and what can you stay consistent with? And people often forget about that point.
That's right. That's right.
Now, I saw on your website that 90% of people who have sleep apnea don't know. What are some of the signs that you could have sleep apnea? Because if I were to talk to my friends, probably a good 70% have trouble sleeping. It's hard to find when you go to a friend group and say, oh yeah, we all sleep so amazing. Everyone seems to have this issue with sleep, or they underestimate sleep when it's so important. I've been wearing like a Whoop device to track my sleep for 4 years as an athlete. I know sleep is important, but most people don't understand that.
Yeah, you're absolutely right. So insomnia, though, it can be a separate issue. You can have insomnia without sleep apnea, but you can have sleep apnea that causes insomnia as well. Those things exist. And we break down insomnia into 3 versions: difficulty falling asleep, difficulty staying asleep, or waking up early in the morning and you can't go back to sleep, right? Those are all 3 forms of insomnia. And they have various reasons. Like, everyone's trying intermittent fasting, and, they want to go through the night without eating. And if you're doing some carbs, so really you shouldn't be doing carbs at all if you're doing intermittent fasting. Those are some things that don't really go well together. But people who have a body that's adapted to carbs, their brain becomes deprived of glucose in the middle of the night, right? Whereas if you're in a ketogenic state and the last meal you had a good amount of fats and proteins in it, your body will derive whatever energy source it needs from the food that you ate. It'll break it down by then.
Interesting.
Yeah. But then again, we come down to the snoring and sleep apnea. So not all people that snore have sleep apnea, but most do. Right. And when we look at longitudinal studies that are like really 20, 30 years long, what we find is people that have snoring but no sleep apnea, they eventually will have sleep apnea. Right. And those, let's say in their 20s that had mild sleep apnea, 20 years later, they'll end up with moderate to severe sleep apnea. That's the general trend. Right. And that's the thing, a lot of people think it's like, oh, you have to be obese. you have to be overweight to have sleep apnea, right? And that's not at all the case. Sure, if you're overweight, you're just adding to the problem. Yeah. Okay. But sleep apnea is a neuromuscular tone deficiency, but it could also be enhanced by poor nasal patency, air blockage with tonsils and adenoids that are enlarged. And again, like bad sleeping habits and bad sleeping positions. So I'm just trying to there's a study in about 10 years ago, just on females, college age with a BMI under 19. Okay. Right. So young, thin females. Okay. They did sleep studies on them and 50% of them were positive for sleep apnea.
Wow. Right? Which is the exact opposite population.
The exact opposite of what you would think would happen. Right. And we know that sleep apnea can cause type 2 diabetes, hypertension, depression, and anxiety. It's associated with Parkinson's, stroke. I mean, just almost everything that's not genetic based, but that is inflammatory based. So in a study they did on adults between the age of 30 and 60, and I bring this up because you had asked, like, how can we know? Right. Yeah. And so one of the ways we can know is the sneaky thing about sleep issues is we don't know we're having them because we're asleep. But the external manifestation could be tension type headaches, depression, anxiety, all those things we discussed. So in this one study, huge study out of JAMA, where they took over 1,400 patients and they had them fill out what's called a Zung's depression scale. Like they rate their own depression, right? Okay. And from as low as I occasionally feel sad thoughts to I consider committing suicide on a daily basis. Yeah. And so they took those scores. And then again, the population was between 30 and 60 years old, and they did sleep studies on all of them and in lab, proper sleep studies. And they found that the severity of their depression and the severity of their sleep apnea was 1-to-1.
That's crazy. Wow.
1-to-1. Now, we have follow-up studies on patients who have both sleep apnea and depression and or anxiety. If you want to look up the research, you'd look up psychosocial issues with sleep apnea. That's the medical jargon for depression and anxiety. And we see either resolution or great improvement of their depression and anxiety once they treat it with either CPAP or oral appliance therapy.
Wow, that's interesting. And
in children, it's with ADD and ADHD.
Yes, I definitely wanted to touch on that because I have ADHD, and I've been reading, for example, the start of this year, I got really deep into the book Breathe by James Nestor. And so since then, I've actually been taping, it must be maybe 8 months now that I've been taping my mouth shut when I go to sleep. And like trying to work on my nasal breathing. So I would love your thoughts on that and thoughts on like, what are some things that people can do to improve their sleep in general without, going as far as getting a CPAP or the oral devices?
Okay. So just in general, we have a term called sleep hygiene. So what we want to do with our bedroom is make sure that it's dark, it's slightly cool in the high 60s, low 70s, and the higher 60s are preferred. Quiet, and the space is only used for sleeping and sex, meaning you don't do your work on your laptop on it. I don't have a TV in any of my bedrooms, because I just want to keep the light out. I want to keep the energy out. And plus, my wife is the kind of person that she can fall asleep to a TV running. I cannot.
My boyfriend too, and it drives me crazy.
I absolutely hate it. And she doesn't know that she's getting retarded sleep by having the TV on, right? Yeah. On rare occasions, like just a few times a year, she'll go down to the living room and watch something and then just fall asleep on the sofa. She just loves it. I find it detestable. But just the light and the noise will reduce the ability to get all the proper sleep stage. Because you're telling your brain to be vigilant. You're telling your brain, I'm not in a safe, dark space. I am in a place where there's activity going on and I'm going to be unconscious. So you're going to have to be a little bit vigilant. We're going to have to compromise the sleep just to make sure that we don't die.
That's a really, you know what? I'm going to take that clip and show it to my boyfriend when he tells me he wants to watch TV.
That's the way. Everything you think about health, please think of it in the context of evolution, survival, and neurology. Those are the three ways you have to think of it. And when you think about, like, oh, it could be this, it could be that. Well, if we look at the evolution, neurology, and survival aspect of it, then you'll get closer to the number one reason than you would anything else.
I love that, because I love having conversations like this where it opens up that conversation of, it's back to the basics. It's improving our sleep. It's getting outside. It's doing these things that almost in today's day and age with the technology we have, people don't want that answer because they think it's not complicated enough. So that must not be the real answer. And it's like, no, these are the root problems. It's not something super, super complicated. It's, a lot of these things are sleep and proper alignment of your body and movement and all these things. That being said, what are some sleep hygiene things that people can do, throughout the day? Because I know what we do, like drinking caffeine or getting sunlight or supplements we take. This all affects us. We think that maybe we get ready for sleep 5 minutes before, but it's really, it's a whole 24-hour cycle.
That's right. So we have such great questions you're asking. I'm really loving your podcast.
Appreciate it.
We didn't, we will admit, right? We didn't have like a conversation before talking about what you're going to ask and what I'm going to talk about. You just are really doing this based on your own intelligence and your own questions about life and for your audience, So I really want to compliment you on that. Yes, good. It's a great way to be in life. So we have a mechanism in our brain called the circadian rhythm, and it's dictated by light and it's managed by cortisol. So when we wake at about 6 a.m., that's our peak cortisol. We talked about vigilance. That's our vigilant hormone, right? We need that to kind of be alert and to handle any situation that we have. And then by 6 p.m. or so, it should drop, right? Now, our brains, again, evolution, neurology, and survival, our brains cannot tell the difference between a photon of light that comes from the sun and a photon of light that comes from a screen. Okay. So when we are like staring at a screen, or we're just watching a lot, where our jobs aren't to be in front of a screen all day, Zoom calls and etc. We're not getting a normal array of sunlight. And then this is also not the sunlight that triggers vitamin D production from our skin receptors either. Right. So there's a big difference between being out in the sunlight versus being in the screen lights, right? Yeah. So one of the things I recommend are these blue blockers. It's these orange glasses. And believe it or not, the darker the blue blocker, the better. It's like a dark orange. Like the one I wear is a dark orange, and it's fabulous. And at a minimum, as soon as it's dark outside, I like to wear it. Okay. And I found actually, if I have a lot on my mind and I'm having a hard time falling asleep, I told you I was just consolidating alone. That took a lot of time, effort. When that happens, I'll sometimes put the blue blocker on way early, like at 6 p.m.
Okay.
And you get used to it very easy. Yeah. Very quickly. And I find that by 10 p.m., I'm yawning, and 9:30 p.m., I'm yawning and going, oh my God, honey, I'm going to go back. And it's done and I'm out. Right. So those are the kind of things that we can do to protect us from that light. Always. This to me sounds commonsensical because I've been doing this since I was a kid. Avoid the news.
Oh, yeah, especially over the past couple of years.
No, ever since I was 10 years old, I was a very sensitive kid. And one time I was watching the news. I think I was with my dad and I was 10 years old. And they showed in Japan a janitor that went crazy and knifed a bunch of kindergartners. I still get emotional talking about it. I'm going to be 48 next month. Okay. So yeah, just avoid it. It has the reputation. It's called the bad news. Yeah. Right. And this is an apolitical statement. I don't care if you're watching Fox News or CNN, they give misinformation.
And it's meant to trigger your cortisol, right? Like to make.
And it does. It triggers you. So you'll go to bed thinking, hey, this contradicts everything that they were saying last month, you know, and you go to bed and you're like pissed. Yes. You're upset. And it's don't do it. Don't waste your time. Don't waste your time. Don't waste your life. Don't waste your energy and your sleep on that information.
Oh, well, fantastic advice. I mean, I try to compromise with my boyfriend about the TV before bed, but that's a big one, especially if, for example, later in the night after dinner, we're watching, maybe some sort of series that could be intense because it could be like a drama or a thriller or something like that. I mean, I try to stay away from scary movies because I'm like, why trigger myself? But, you watch something and it kind of triggers you. You're feeling, attached emotionally. And so what he watches before bed, and this is the compromise, is he puts on like a Friends episodes that he's watched 50 times before. Mm-hmm. So yes. At least, your brain already knows what's going to happen.
Exactly. It's mindless.
Tones it out. Exactly.
Oh, I've done it before too. I sometimes will take lunch and I'm into Formula One racing.
Oh,
and
us too. Yep.
Oh, are you?
Yes.
And I'll pull up a Formula One race highlights reel that I've seen probably 10 times. And it's just relaxing. Yeah. It empties your brain. That's fine. That's fine. And especially if you can find it, it's not so easy to find, but if you can find things that are uplifting.
Yeah.
That's also makes you feel good because there is more positive things being done on earth than the negative. But all media focuses on the negative.
Yeah.
Right. And they try to, the greatest example I can give was when we went after the Taliban. Right. There was like a handful of these people, right? Handful. It was just, we could have sent one Navy SEAL troop and get them all. It was not a big deal. Right. But every day on the news, they were hammering it in. They would put a microscope on them and made it look like they're taking over this whole country. These 100 people were taking over this whole country. And that's not the case. That's not the case. So avoid news media. But if you want to stay informed, talk to doctors who actually read research and don't have a vested interest in what's going on in today's climate. Look for alternative media outlets like that. Ben Swan has his own thing. What's his name? The Children's Health Defense. They're very evidence-based and they don't have a political spin or bias or anything like that. And from my point of view, the information I'm seeing is positive, but even when it's slightly less positive, it's truthful.
Right.
And there's something you can do with the truth that you just can't do with a lie. You can't, you can get yourself worked up over a lie, but the truth, you can actually feel, okay, maybe I can do something now.
Right. Mm-hmm. Well, that's exactly why I tell, people, other athletes, people who are social media influencers, like, don't check your comments before bed. Like, why would you do that to yourself? One of the worst
very
things,
good.
And straight first thing in the morning either. Like, you're just going to stress yourself out.
I agree with you. It could be like daggers. And ironically, the flip side is you don't get the same level of joy on the flip side reading the compliments. Right. Exactly. It seems like most people just take in the negative and not so much the positive. So, and then you talked about your athletes. I wanted to talk to you about performance mouthpieces for athletes.
Yeah.
Right. That they can use one, that you can sleep with an appliance, obviously, to help you sleep, because clenching, we clench our teeth at night, which then causes a myriad of jaw, muscular, teeth, and health problems from stress, but also from sleep apnea. Right?
Oh, as a kid, I grinded my teeth. Every time I went to the dentist, they would drive the dentist crazy. She's like, you're going to get rid of all your teeth. And then I would try to wear I don't know, they gave me some mouth guard, but it wasn't a good one that they gave me. And all of the time I felt like it was shifting my jaw. And so my compliance, exactly what you said, was very, very low. So I would wear it for a couple of days and then I would stop. And that lasted maybe a month until I never wore it again.
Yeah, exactly. Yeah. And it's more challenging on a growing child, right? Because you don't want to make anything that locks them down. So I make mine that are developing of the jaws while they're controlling the clenching.
Okay.
Yeah.
So would you say, let's talk more about the performance mouthpieces, because let's talk about them for sleep. Let's talk about it for, like you said, strength. And then I know even we were talking about this airwave thing that people are using now for endurance to hold the tongue down in proper position. Because like I was just telling you, I've been taping my mouth shut. I've been learning more, breathing through my nose. I can kind of run and do stuff up to a certain heart rate through my nose until then I have to, higher intensity, I go back to my mouth. So how can we improve, our jaw alignment? How does that work into athletic performance and breathing? Yeah. Let's talk about all that stuff.
So it comes down to neurology, right? And Roman soldiers actually during battle would talk about biting on a piece of leather. Like they would bite on a piece of leather to get more power as they would do their fighting and warring. But it comes down to neurology. The joint that has the most innervations, most proprioceptive innervation, is the jaw joint. Yeah. And I think the second most is either the SI joint or the feet. But the jaw is number one. Yeah. Okay. And like we say, when you want to lift something heavy or do something like that or punch, first thing you do is you clench your teeth. Right? You want to screw something heavy, you got to clench your teeth to do that. So when you have an appliance that holds your jaw in the ideal jaw position and also protects your teeth from that clenching, now it allows you to use more power to get what you need done. So it's very interesting. So we also make appliances for concussion, right? For like football, boxing, even basketball. But we make them for, athletes in the gym, for professional kickers in like the NFL to get more length. And actually can even help with fine-tune things. But it's interesting. So for example, when we make a performance mouthpiece for a golfer, we tell them assuming they don't have a jaw problem. So if they don't have a jaw problem, they don't need to wear it all the time. They just wear it while they're like in the gym, for example. You can wear it while lifting weights. But even then, we say a little bit with caution, because let's say it improves your performance by up to 25%. That's a lot. That's on the high end. Most of the time, it's between 10 to 15 to 20, right? Okay. However, if you've been working out, let's say you can lift, 50 pounds on a dumbbell, and now you want to go and lift, 60 or 70 and 50 was your max, right? Well, the problem with that is as you're lifting, if you just jump from your max of 50 to your max of 60 now, you could have a tear.
Right.
You could have an injury.
The whole system isn't ready for that.
That's right. Your neurology is ready, but your tissues aren't ready. So you have to build them up. So we always tell them, it's like, listen, I know you can do it. I don't want you to do it. Go to 52, go to 52 and a half, go to 55, go to 57, go to 60. Right. I go just so you don't injure yourself. Right. But coming back to golfers, we have them put them in and they'll get an extra 50 yards, 60 yards, 70 yards from their long drive.
Wow.
Yeah. But at the same time, what's really fascinating is if they try to do their short game, their little putt game, if they have the appliance in, it messes them up.
Right. Huh. Interesting.
Right. Because their body is like so much geared for more power. And this is where they have to be very fingertippy, very delicate and be precise. Okay. So we tell them, leave it out on your short game, leave it in on your long game.
Interesting. And now do you usually make them for the top or the bottom? Like, what do they look like?
For performance, we're doing them on the bottom. When we're not worried about concussion, we're doing them on the bottom, and they're custom made. We have a CT scan that we use to measure the exact jaw position. I do a neurological exam to make sure that's the right jaw position for them. We laser their jaws to calm the neurology so we can actually capture that jaw position.
Oh, wow.
And then we make it to that jaw position.
That sounds a lot better than the mouth guards that I ever got made, because as you growing up in hockey, snowboarding, now CrossFit, I've been wearing tons of mouth guards, especially with hockey. And then also with snowboarding, which most people wouldn't really associate, but it was definitely a big thing for preventing concussion. Yeah. And I would get them dentist fitted, but like I told you before, even with the one I wore at night for my teeth grinding, it wasn't ever felt like the right alignment, but they weren't doing all those tests. It was just an X-ray and then put in. They weren't doing the CT scan. They weren't doing all these different things to see what's the actual right alignment of your jaw. They're just saying, here, put this in and it'll space out your teeth.
That's right.
Very interesting.
Very, very much different. And then, like I said, on my website, I have research for performance appliances where you can see where this ideology comes from.
Right. And so is there like an ideal airway, an ideal method of breathing that these things can help you with? Like, I know this one I have here is to kind of, keep your tongue down. It's also kind of open up your airways, but I'm interested in hearing your thoughts on that, especially with the nasal breathing versus mouth breathing and all that kind of argument.
Well, first of all, I want to say I'm not a big fan of lowering your tongue. I want the tongue up on the roof of the mouth, first and foremost. If someone has sleep apnea and we need to keep the tongue down so that the tongue doesn't go up and over into the throat, that's something that I do in my practice, but it's not even an optimal situation. I would love to be able to treat them without forcing the tongue down. I want the tongue up and forward.
Okay.
Yeah? And the taping is a great idea, assuming you don't have acid reflux and you're doing it under doctor's supervision, because by forcing yourself to only breathe through your nose, you're maintaining a normal level of end-tidal CO2. And we have way more receptors of CO2 in our body than we do for oxygen. I think we only have 2 for oxygen. Okay. But with CO2, we have, I think, nearly 1,000. So if our end-tidal CO2 is not within a normal range, let's say between 35 and 45 millimeters of mercury, then the oxygen, so if it's too low, the oxygen in our hemoglobin will not be allowed to liberate, right? So you could have a wonderful oxygen desaturation of 99, 100%, but if your end-tidal CO2 is low, you won't be able to liberate the oxygen from the hemoglobin out of your blood. If it's too high, if you go past 48 millimeters of mercury, it's associated with death. It's, and it's a lot harder to get it high than it is to get it low.
Interesting. Okay.
Yeah.
Okay. So that kind of makes sense and kind of puts together a few things that I've heard definitely about, the breathing, the CO2 and different things. It'll be interesting to try this mouthpiece and see, because it's becoming a new topic. Like, you never saw it in the sport of CrossFit. I have seen some people wearing it doing deadlifts or something like you talked about with the max power. Very few people, I think people, they don't want to be stigmatized as trying that hard. Right. But I'm like, you're a professional athlete. If this can improve, why wouldn't you do it?
Why wouldn't you do it? So, yeah, I mean, I think it was Serena Williams one time wore these tights, these yoga pants that controlled the shock and rebound in the muscles when running and stomping to catch a ball and hit it with a racket. You can do that. It's not illegal. I mean, you're not even hurting your body like you would with the steroid. I mean, it's just holding things together. And if you can improve your body's neurology easily and naturally, and in my case, precisely, then why wouldn't you? I think if it matters enough to you, I would do it. It's very interesting. As we started in the beginning, we were talking about growth hormone and sleep. I'll hear these guys, these performance guys, talk about if you run like this and you eat this meat and you do that, you'll increase your growth hormone by 0.12% or something trivial and try it. And I go, well, if you got a good night's sleep, you'll get way more growth hormone than that. You could measurably see a difference. Yeah.
Well, right. It goes back to people wanting the complicated answer because it sounds more realistic than just the simple answer of get better sleep.
That's right.
And sometimes, like we've been talking about this whole time of improving your sleep, it can be more complicated than you think. And so even though it is a simple solution and answer, there's a lot of complicated things that might go into actually improving your sleep. And
that's right.
And going back to like you talked about in the deep sleep at stage 3, we get the growth hormone, and then we have the REM, which is the more mental recovery. Obviously, as athletes, especially that growth hormone stage, that deep sleep, you really want to be maximizing that because you're beating your body up. But I'm sure too, REM is extremely important just for the mental recovery. Maybe is it for skill, like remembering skills that you're working on and things that you need to kind of go to memory. And hopefully I didn't missay that. But could you talk about like what's ideal? Like how much should we be getting of that kind of those stages, the different stages of sleep? And is there a too much?
I haven't seen it too much. I mean, there are people with, hypersomnia who, sleep too much and they can sleep 12 hours and it feels like it's not enough. Oh, that's a different problem. Also very rare, but that's a different problem. With the actual normal amounts of sleep. So we want a minimum of 8 hours of sleep. I'm hearing now people saying 6.5 and 7 is enough. It's not enough. Okay. You need 8 or more hours of sleep. And 25% of our sleep should be REM. Okay. 25% of our sleep should be delta. And the other stage 1 and 2 should be 50%. Right. Okay. That's for an adult. For a child, like a newborn, is almost 100% delta or REM.
Right. You're very neuroplastic as you're growing and remembering and learning and growing so fast, right?
Yeah, exactly.
Interesting. So this is kind of a deeper topic within this, and especially talking about REM sleep. But I think it's very interesting because we had 2 podcasts earlier in the year. One was with an Olympian javelin athlete who's one of my friends. And we were talking about last year, we were experiencing very high REM. We both kind of track our sleep and track everything. And we were feeling kind of low stress, and we were getting like 30, 35, even seeing 40% REM, which was unusual for us, and having crazy dreams. And we were trying to figure out our why. And so we did an experiment where we tracked not just in our kind of our apps, but we actually, we would write down every morning what percentage REM sleep we got, how long we slept, but we would try to track different things we did during the day. Did we experience a flow state with like sport or training? How long did we meditate? We were trying to track these things. And we then had someone who came on and talked a little bit about sleep later on. And he kind of said that maybe meditating so much and being in that state during the daytime, then it's replicated. So if you're in really high stress and you're not handling it well in the day, that can then kind of cycle back into your sleep. But if you're spending a lot of time in that relaxed state in the daytime, it could reflect in the sleep with, that similar cycle of REM. What are your thoughts on that? And I thought for a while that it was bad because I was experiencing these crazy dreams and I was like, I don't want to have these crazy dreams anymore. But I do recognize that REM is extremely important.
It is extremely important. So I have a lot to say about that. So first off, I haven't found anything that is a good measure, like these over-the-counter products,
right, that
measures your sleep staging properly. The only way you can measure your sleep staging is tapping into your neurology, your brain waves. The Oura Ring is okay. It's okay. The Fitbits, in my experience, and mind you, the technology may have improved since the last time I looked at them, but like the stuff like that is just worthless. in terms of collecting data, right?
Apple Watch.
Yeah, I mean, I don't know enough about the Apple Watch to tell you, but again, in the past, they were worthless if they even bought. In the first few Apple Watches didn't even check sleep. No. Now they're saying they do. And again,
when you put that many things in one, I don't believe that it's, like at least when it's the Oura Ring or something, I'm like, okay, they say they specialize in sleep. When you try to tell me you can do every single thing at once, I'm like, that sounds like no.
Thank you. So that's one aspect. The other aspect of it is we are finding that people who meditate, transcendental meditation, and the ones that go really deep into meditation, they are opening up their brain to getting better theta wave, which is REM sleep.
Okay.
Right? And so that's what's so great about meditation. It's like you're giving yourself that. It's like when you're awake, you're giving yourself that stage of sleep. It really is glorious. It really is wonderful. Okay.
And is there something similar that we can do to improve the amount of deep sleep, if that kind of coincides with the REM sleep?
That's a good question.
Because again, with sports, right? Everyone is like, how do I improve my muscle recovery? How do I get stronger faster? And they look at it complicated, but it's like, how can I get that deep sleep? And I know, of course, we talked about, getting tested for sleep apnea and stuff like that, but
yeah. So, I mean, right now, the only scientific answer I could give you would be on the basis of, well, how can we make sure we have uninterrupted sleep, right? The sleep hygiene, the sleep apnea, the bed partner, the quiet environment. That's like scientifically what I can tell you. I know there's some anecdotal reports of, binaural beats, if I'm pronouncing that right, and listening to something that's supposed to do hemisynchronization of the brain and trigger more delta wave through frequency. I would like to see more data in that. That area really excites me, but I couldn't tell you right now, this is a technique that works great for improving delta. The only thing I can tell you definitively is making sure you get a good night's sleep.
Okay.
Yeah.
And I've also heard like the sleep consistency is important too with the circadian rhythm.
Yeah. Going to bed at the same time, waking up at the same time, even on weekends is really great.
Perfect. Well,
yeah, I agree.
This is such a good topic. I mean, diving into sleep is so huge. So that's amazing. And the performance mouthguards, that seems like really interesting science. I'm excited to dig into some of the science and stuff. Do we want to quickly touch on TMJ? Because I've worked with some chiros and massage therapists who they've preached it, the TMJ techniques and the myofascial release and all these things. It seems like it's a big topic nowadays of people wondering, oh, do I have TMJ? What is it? And they have a lot of questions around it.
Yeah. So I'm going to say something right off the bat, and it might sound controversial or biased, but I'm just going to tell you from not just my 15, 20 years of clinical practice in it, but from the literature and physically experiencing it. Okay. In chronic TMJ cases, okay, not acute ones like motor vehicle accident where you had whiplash or, boxing, got a blow to the jaw. I'm not talking about acute cases, which are much more rare than chronic. With chronic cases, if you're not wearing an appliance that protects your jaw from swallowing, chewing, and clenching, nothing that you do will ever work. Okay. And I say this, I'm an acupuncturist, as I think you already know, I'm also an acupuncturist. So I use acupuncture, for my patients daily, right? If I just did acupuncture on people, they would just keep coming back over and over and over again. They'd feel great. And then they'd go home, clench your teeth and back to square one, So same thing with chiropractic, same thing with physical therapy. The problem is when we clench, for example, we just don't clench here. We clench like this with our shoulders, which subluxate our neck, which gives us tension type headaches, right? I mean, there's so much literature showing that when you can prohibit the clenching at night, you can prohibit tension type and even sometimes migraine type headaches. Yeah. And we actually see that also with ENT. So if someone has a chronic sinusitis, they have a deformity in their nose or in their sinus, having a surgery that fixes it can also resolve their apnea, their migraines as well.
Interesting.
Right? So because you're treating the cause of the problem, right? Yeah. And the issue with TMJ is, we have a mechanism in our brain, in our prefrontal cortex, that says, don't give me redundant information, right? So if you walk into a room that smells real bad, after about 5 minutes, you don't smell it anymore, right? Doesn't mean those odor molecules aren't going up to your brain. They are, but your brain just says, I don't want to think about this because I can't do anything about it, right?
Right.
Well, imagine you have a jaw problem. It could be anything like just what we call an effusion, like a swelling in the jaw joint, right? Or a clicking or popping or what have you. And every time you swallow, your teeth come together and it shoves your jaw all the way back into the spot that causes pain. Same thing when you chew food. Same thing when you clench your teeth at night. Well, we swallow 2,000 to 3,000 times a day. And every time we do, we put our teeth together for about a second, right? So if I had a wound on my finger, I know if that I left it alone, if I put some Neosporin and a Band-Aid on it, my body would heal the wound. I'd have a little scar, but I'd be pretty much fully operational after that, right? Now imagine I have the same open wound, but 2,000 to 3,000 times a day, I poke it with my finger, right? It will never get well, right? And it will in fact continue to get worse. Okay. This sends alarms, but the brain doesn't want this redundant information because you have to swallow. So swallowing is a survival mechanism, right? So every time you do that, you're just triggering the pain, right? So with, acupuncture, and I, by the way, I love all these things: acupuncture, osteopathy, chiropractic adjustments. I go and get it done myself. I think it's wonderful and miraculous, but I have no illusions that if I had a jaw problem, that they would be able to help me without an appliance.
Right. You got to fix that root problem, and then you can treat the symptoms.
Then you can build on it, right? Then you can build on it. So like, for example, acupuncture, osteopathy, manipulation, chiropractic helps the person, right? But then they go back to square one, right? But so once you have something in appliance that's properly made, then they get to go to step 2, square 3, square 10, and then until you're at 100.
If nothing has convinced me to go and get my grinding of my teeth finally checked out or something, this definitely has.
Good.
Yeah, I'm just thinking through, like, as you're saying everything, I'm like, oh, like all those years of grinding my teeth, and then I just gave up on what it was. Who knows how this could have affected different things, my movement patterns. Crazy. I mean, sleep and all these things, we do affects it. And people often forget that. But if we are spending 8 hours in sleep, and we're not thinking about what we do in it or how we can improve it, then that's a missed opportunity when we're fighting for those 1% in our sport or in our day-to-day lives or our performance mentally even.
That's right. So
if we could sum up what we talked about into like let's just say 3 to 5 main tips for someone looking to improve their sleep quality, what would those tips be?
To improve their sleep quality. Okay. Making sure that you can breathe through your nose clearly, easily, effortlessly, that you sleep in a dark, quiet, and cool room, and be consistent at it.
Okay.
And then if you're having a challenge with any of those, right? So like, for example, the number one cause of insomnia is pain, right? So if you're having problems with jaw pain, headaches, whatever, go seek help, right? If you're having trouble breathing through your nose, go see an ENT, go seek help. And have a talk. And sometimes, people hate the idea, bed partners hate the idea of sleeping in different bedrooms, right? And I tell them, I go, I hate the idea of getting bad sleep every night, right? So while your bed partner is getting their problem resolved, go ahead and sleep in different bedrooms and then have the goal of coming back together again once the snoring or sleep apnea or whatever the issue is resolved.
Love that. That's perfect. I have two questions I ask every guest and like to end with. The first one is, out of all the daily habits that you have, and I'm sure this will be sleep related, what is the biggest game changer, that one biggest thing that like you could not possibly do without?
Oh my God. So I wear a night appliance because I have sleep apnea and it's resolved with my appliance. And I also clench my teeth. My goodness gracious. I cannot go a night without it. I will not be able to function without it. I'll be cranky because I'll have terrible sleep. I'll wake myself up choking. And my jaw will hurt when I wake up in the morning. That's right. That's kind of an easy sort of routine. But I try to eat keto. I do intermittent fasting, try to get a little bit of exercise in. All of these are important, but if I don't get a good night's sleep, it's all for naught. Literally, all of it is worthless, because you could have a 0 carb diet, but sleep terribly, and your inflammatory markers will go through the roof.
Right. Yeah. Yeah, no, that's huge. It is very huge. And of course, everyone preaches the anti-inflammatory diet and managing your recovery and buying, the Normatec boots and all these things. But again, it's the overcomplication when it's like, let's fix the foundations there. So exactly. Love that answer. Knew it would be about sleep. The last one is it's a makeshift scenario in your head. You're at the end of your life. You've lived out 100 years, 150 years, who knows what our lifespans will be. And you're looking back. What is the impact that you wanted to have made?
Oh my God. If I can have people take care of their psychological health, first and foremost, take ownership of their own challenges, right? There is a word called projection that means whatever you're feeling, anger, jealousy, whatever, is about someone else is actually just a projection about how you feel about yourself, right? Yeah. So if people took ownership over their own domain, because we talked about watching the news and how useless that is. We have way more control about how we control ourselves versus other people and other things. So if first and foremost, if we take personal responsibility for our mental health and our mental well-being, and then we take personal responsibility for our physical health, diet, exercise, and sleep. If I can get the awareness of that out into the world for longevity, for resilience, then I'll feel very, very happy when my time comes.
I love that. And I appreciate you for sharing all the knowledge that you did on this podcast. Hopefully it will help you move towards making that impact, because I know, you helped me. Some of these questions have been burning ones that I've had, even about my own issues. So that's super cool. And I hope that everyone listening just understands that sleep is not to be overlooked. And it's so important for us all.
It is. And if you guys want more information, I've done a bunch of YouTube videos. I did a 1-hour Google Talk. You can just type in Google Talk, Dr. Shirazi in YouTube, you'll find it. My website, I have 2 offices in the Los Angeles area, tmjla.com or tmjconejo.com. And it's just chock full of information if you or your audience wants more.
Perfect. I'll make sure to put in the show notes so people can find out more information and look at like the studies you mentioned and everything, because I know that'll be perfect. And my audience is as curious as I am, so I'm sure they'll want to dive into it.
Wonderful. Well, great. That's great.
Well, thank you so much again for coming on.
It's my sincere pleasure. Thank you.